Imagine this. You're at home, maybe cooking dinner, enjoying a quiet evening with your family. Suddenly, you hear it. A loud, sharp crack of electricity, followed by a cry of pain. You rush into the room, see a loved one, frozen and shaking, in contact with a faulty appliance, a live wire. In that terrifying instant, your world stops. This is not a scene from a movie. It is a real-life emergency. That can happen in any home, at any time. This can lead to cardiac arrest. The heart stops beating altogether. The longer a person is without a heartbeat or breath, the greater the risk of permanent brain damage or death. But I want to reassure you, even in this frightening scenario, there is so much you can do. By understanding a few simple, crucial steps, you can take control of a chaotic situation and dramatically increase the chances of a positive outcome. Your knowledge is your power. This isn't about becoming a medical expert overnight. This is about empowering you, the bystander, the family member, the friend, to act confidently and safely. Many lives are lost not just from the initial shock, but from well-intentioned rescue attempts that go wrong. People instinctively rush to help, touching the victim and becoming part of the electrical circuit themselves. Let me tell you about a case I remember well. A young man named Mark was using an old power tool in his garage. The cord frayed and sent a powerful current through his body. His wife, Sarah, heard the noise and found him collapsed on the floor. Her first instinct was to grab him, but she remembered something she had seen on television. She stopped, took a deep breath, and ran to the circuit breaker to cut the power. That single 2-second decision saved her life and gave her the crucial window to call 911 and start CPR. Mark survived. His doctors agreed Sarah's calm, correct first response was the key. This is the power you have. Yeah. Your absolute first priority is your own safety. This may sound counterintuitive when someone you care about is in danger, but you cannot help anyone if you become a victim yourself. If you see someone being electrocuted, stop. Do not touch them. Electricity can travel through their body and into yours, creating a second medical emergency. Take a moment to assess the situation from a safe distance. Look for the source of the electricity. Is it a downed power line? A sparking appliance? A wire in a puddle of water? Your eyes and ears are your first diagnostic tools. Verbally warn anyone else nearby to stay back. Shout, "Stop! Do not touch them." It's an electrical shock. Once you have assessed the immediate danger, your next goal is to shut off the power source. The safest and most effective way to do this is by turning off the main power at the fuse box. The safest and most effective way to do this is by turning off the main power at the circuit breaker. If you know where it is, go there immediately and flip the main switch. This will cut electricity to the entire property, ensuring the danger is neutralized. If you cannot get to the main breaker or do not know where it is, look for the switch on the wall outlet or power strip and turn it off. Only attempt this if you are certain you can do so without putting yourself in harm's way, staying clear of any water or exposed wires. What if you cannot turn off the power at its source? This is a high-risk situation that requires extreme caution. You must try to separate the person from the electrical current, but you cannot use your hands. Look for an object that is dry and does not conduct electricity. A wooden broom handle, a dry piece of lumber, a thick, dry towel, or a rubber mat. Do not use anything metal or anything that is wet or damp. Carefully and firmly use the object to push or pull the wire or appliance away from the person. Or, if it is safer, use the object to push or pull the person away from the electrical source. Do this only as a last resort. If you are unable to turn off the power or safely move the person away from it, your next action is immediate and non-negotiable. Call for emergency services. Dial 911 or your local emergency number right away. Be clear and concise with the operator. Tell them, someone is being electrocuted and is still in contact with the power. Give them your exact address and explain the situation. The emergency responders are trained for these specific scenarios and have the equipment to handle live electricity safely. While you wait, your job is to keep yourself and everyone else far away from the victim and the electrical source. Do not attempt any further rescue. Stay back. Once the power is confirmed to be off and the scene is safe, you can finally approach the person. Your immediate task is to check for responsiveness and vital signs. Kneel beside them and gently tap their shoulder. Speak to them in a loud, clear voice. "Are you okay? Can you hear me?" Look for any sign of response, a groan, an eye movement, any stirring at all. If the person is unresponsive, you must immediately check for breathing and a pulse. Look at their chest to see if it is rising and falling. Listen for the sound of air moving from their mouth or nose. Feel for their breath against your cheek for about 5 to 10 seconds. Simultaneously, you should check for a pulse. The easiest place to do this on an adult is the carotid artery in the neck. Place 2 fingers on their windpipe and slide them into the groove on the side of their neck. Press gently and feel for a steady beat. Checking for a pulse can be difficult for an untrained person, especially in a high-stress situation. Therefore, the most important sign to focus on is breathing. If the person is not breathing or is only taking infrequent gasping breaths, known as agonal breathing, you must assume they are in cardiac arrest and need immediate help. Time is of the essence. If the person is unconscious and not breathing normally, you need to get help on the way immediately. You, in the blue shirt, call 911 right now and tell them we have an unresponsive person after an electric shock. Come back and let me know when you've done it. Being specific prevents the bystander effect. If you are alone, call 911 yourself. Put your phone on speaker mode and place it beside you so you can talk to the dispatcher while you begin the next steps. They can guide you through what to do until help arrives. If the person is breathing and has a pulse but is unconscious, protect their airway. Roll them onto their side into the recovery position. Kneel beside them. Extend the arm closest to you above their head. Bring their other arm across their chest. Bend their far leg at the knee. Gently pull on their bent knee and shoulder to roll them toward you. This position keeps the tongue from blocking the throat and lets fluids drain. Continue to monitor their breathing closely until paramedics arrive. Okay, stay with them. Section 4. Life-saving actions. CPR, burns, and managing shock. CPR. Managing shock. If you have determined that the person is not breathing, you must begin cardiopulmonary resuscitation, or CPR, immediately. Don't be afraid. Hands-only CPR is effective and easy to perform. Kneel beside the person's chest. Place the heel of one hand in the center of their chest, right on the breastbone. Place your other hand on top and interlock your fingers. With your arms straight and your shoulders directly over your hands, push down hard and fast. You should compress the chest about 2 inches deep at a rate of 100 to 120 compressions per minute. A good way to keep the rhythm is to push to the beat of a familiar song, like "Stayin' Alive" by the Bee Gees. Do not stop chest compressions until medical help arrives and takes over, the person starts breathing on their own, or an automated external defibrillator, AED, is ready to be used. If an AED is available, use it immediately. These devices are designed for untrained users. Open it and turn it on. It will give you clear voice prompts telling you exactly what to do, including where to place the electrode pads on the person's bare chest. The AED will analyze the heart's rhythm and advise if a shock is needed. Follow its instructions precisely. CPR and early defibrillation are the most critical interventions for surviving cardiac arrest from electrocution. After the immediate life threat of cardiac arrest is addressed, or if the person was breathing from the start, you can assess for other injuries. Electric shocks often cause burns. You may see 2 burns. One where the electricity entered the body and another where it exited. These burns might look small and insignificant on the surface, but they can be associated with extensive damage to deeper tissues. Do not put ice, butter, or any ointments on the burns. Simply cover them loosely with a clean, dry cloth or sterile dressing to protect them from infection. Do not break any blisters that have formed, as this can increase the risk of infection. Section 5. The Shock to Safe Checklist, your simple guide to a complex crisis. In the middle of an emergency, it can be hard to remember everything. That's why I've created a simple, clear checklist for you. Think of this as your mental roadmap to guide you from the moment of shock to the arrival of safety. Memorize it. Write it down. Keep it somewhere accessible, like inside a first aid kit, or on your refrigerator. Following these steps in order will keep you safe and maximize the victim's chance of survival. This is your shock to safe checklist. It's your plan to conquer the panic and take decisive, life-saving action when every single second counts. First, step 1. Secure the scene. Your safety is paramount. Do not rush in. Stop. Look. Listen. Identify the electrical source. And, most importantly, do not touch the person if they are still in contact with the current. Shout to warn others to stay away. This is the foundational step that prevents one victim from becoming two. Only when you are sure you are safe can you proceed to the next step. This initial pause is not a delay. It is a critical safety measure that allows you to think clearly and act effectively. Next, step 2. Shut off the power. If you can do so safely, go to the circuit breaker or fuse box. Turn off the main power. If that's not possible, use a dry, non-conductive object like a wooden broom handle. Move the electrical source away from the person, or the person away from the source. If you cannot do either of these things safely, your immediate action is step 3. Call 911. Tell the dispatcher that someone is being actively electrocuted. Finally, once the scene is safe, you move to patient care. Step 4. Check for response. Check for breathing. If the person is unresponsive and not breathing, proceed to step 5. Begin CPR and use an AED. Push hard and fast in the center of the chest. If the person is breathing, move on to step 6. Treat burns and injuries. Cover any burns with a clean, dry cloth. Check for other trauma from a fall. As you do this, always step 7. Monitor for shock. Keep the person warm. Keep them lying down. When help arrives, step 8. Report to responders. Give them all the details. This checklist is your guide to being the hero in a crisis. The road to recovery. From ambulance to hospital care. Tell them exactly what happened, how they were shocked, possible voltage, and how long. If you found this guide helpful, please give it a thumbs up to like this video. Share it with your family and friends. This is information everyone should have. Leave a comment below with any questions you might have. And most importantly, hit that subscribe button and ring the bell to join our Real Tips Hub community for more life-saving advice. Be safe and be prepared.